By the end of Module 7, you will be able to understand the impact and prevalence of chronic diseases in elderly populations, apply evidence-based approaches to managing multimorbidity and polypharmacy, design individualized chronic care plans that involve caregivers and lifestyle support, recognize when to involve palliative care and psychological intervention, support family caregivers to manage long-term illness with compassion and skill. This module delves into the complex, multi-layered management of chronic illnesses in elderly populations, recognizing that older adults are disproportionately affected by non-communicable diseases, NCDs. These conditions, which include diabetes, cardiovascular diseases, chronic respiratory illnesses, arthritis, Alzheimer's, and cancer, significantly impact quality of life, functional independence, healthcare utilization, and mortality rates. The module is framed using global best practices from WHO Global Strategy on Integrated Care for Older People, ICOPE American Geriatrics Society, AGS, Guidelines National Institute for Health and Care Excellence, NICE, Chronic Care Model, CCM, National Institute on Aging, NIA, Standards. Emphasis is placed on holistic, person-centered, multidisciplinary approaches, preventive care, early detection, medication reconciliation, caregiver engagement, and using digital health tools for chronic disease management. Understanding the burden of chronic illness in geriatrics. Over 80% of adults age 65 plus have at least one chronic illness. 60% have two or more. Chronic diseases are the leading causes of death in older adults worldwide. The cumulative burden leads to frailty, polypharmacy, disability, depression, and frequent hospital admissions. Key chronic illnesses in the elderly: cardiovascular disease, e.g., hypertension, heart failure, stroke; diabetes mellitus, type 2, chronic obstructive pulmonary disease, COPD; osteoarthritis and rheumatoid arthritis; chronic kidney disease, CKD; cancer; neurodegenerative disorders, e.g., Alzheimer's, Parkinson's; multimorbidity and geriatric syndromes. Multimorbidity equals to presence of two or more chronic conditions in one person. Leads to complex medication regimes, polypharmacy; risk of drug-drug interactions; need for coordinated care plans; risk of cognitive decline and falls; common geriatric syndromes associated; frailty; sarcopenia; delirium; incontinence; sleep disturbances; depression; chronic disease monitoring and care planning; individualized care plans involving physicians, nurses, dietitians, physiotherapists, and caregivers; routine monitoring; blood glucose levels, diabetes; blood pressure and cholesterol, hypertension, heart disease; lung function tests, COPD; kidney function tests, eGFR, creatinine; pain and mobility assessments, arthritis; cognitive assessments, Alzheimer's; use of, telemedicine platforms for remote monitoring; electronic health records, EHR, for care coordination; medication adherence apps and devices; polypharmacy management and medication review, defined as use of 5 or more medications; risks, falls, confusion, poor adherence, hospitalizations; solutions, periodic medication reconciliation, use of Beers criteria to identify potentially inappropriate drugs; collaboration with clinical pharmacists; use of pill organizers, reminders, home delivery; medication review process, verify indication, dosage, interaction; monitor side effects; discontinue unnecessary medications; adjust according to renal, hepatic function; role of lifestyle interventions in chronic illness control; nutrition, heart-healthy diets, DASH, Mediterranean; diabetic-friendly food planning, anti-inflammatory diets for arthritis; exercise; prescribed physiotherapy, low-impact aerobic exercises; stretching, resistance training, balance programs; sleep hygiene, stress reduction, and spiritual wellness, smoking cessation and alcohol moderation, psychosocial and palliative dimensions, chronic illness effects, mental health, depression, anxiety, grief, demoralization, social connections, isolation, stigma, caregiver fatigue, finances, medication costs, transport, loss of income, encourage, support groups, spiritual counseling, psycho-geriatric intervention, advanced care planning, early integration of palliative care for terminal or unmanageable illness, caregiver involvement and family support, educating family caregivers about symptom monitoring, emergency signs, nutrition and medication, proper transfer techniques,